Welcome to Cattaraugus County Office of Emergency Services video on doffing, or taking off our PPE, personal protective equipment, that has been done for taking care of an Ebola virus disease patient. I'm Kathy Peters.
I'm Naomi Maddox.
And I'm Bobby Combs.
And today Naomi will be our trained observer. She'll be reading us our instructions from our PPE checklist to walk us through the proper doffing of our PPE. Starting first, she will gather the proper equipment as our trained observer.
2 chairs labeled 1 and 2, spaced significantly apart. EPA registered disinfectant wipes or disinfectant spray, alcohol-based hand sanitizer, large garbage can with red bag liner, and 2 large red bags, big enough to put both feet into and doff coverall, and a box of nitrile gloves, proper size for provider doffing PPE and trained observer. Doff PPE in correct order, slowly, carefully, and methodically. When using alcohol-based hand sanitizer and disinfectant, be sure to allow for proper contact time for disinfecting. Contact times must be ensured between each step to allow for any potential virus to be killed completely. A reference for contact times can be found at the bottom of this checklist. Inspect PPE to assess for visible contamination, cuts or tears. Consider disinfecting the entire coverall with disinfectant wipe or spray, regardless of visible contamination. If there is visible contamination, then disinfect using the disinfectant wipe or spray. Allow for proper contact times. Stand in large red bag. Both feet should be inside the bag. Disinfect outer gloves with disinfectant wipe or alcohol-based hand sanitizer. Rub hands together for 20 to 30 seconds and allow to completely dry. Remove outer pair of gloves using glove and glove technique and discard properly. Inspect and disinfect inner gloves. If tape was used, slowly and carefully remove tape that is attaching inner glove to the sleeve of the coverall. If tape was used, inspect and disinfect inner gloves. Now remove face shield by tilting head forward and grabbing the rear strap and pulling it overhead without touching front of face shield, and then discard properly. Inspect and disinfect gloves. Remove surgical hood by untying and tilting head forward. Grab top part of hood, remove, and discard properly. Inspect and disinfect gloves. Disinfect zipper area of coverall from neck down to the bottom of the zipper using an EPA registered disinfectant wipe. Allow for proper contact time for disinfecting. Inspect and disinfect gloves. Open zipper seal if used, and carefully unzip suit while minimizing contact with outside of coverall. Avoiding contact with outside of coverall, pull arms from sleeves and push coverall below the waist. Trained observer may assist with this process. Sit in chair 1 and remove 1 foot from coverall, being careful to avoid contact with outside of the suit. Step foot outside of the red bag. Repeat for second foot. Boot covers are removed with the suit. Ties can easily be broken by pushing them from the inside of the suit. Inspect and disinfect gloves. Trained observer, if assisting with removal of coverall, must complete this step. Remove inner gloves and disinfect hands with alcohol-based hand sanitizer. Don a new pair of gloves. Remove N95 respirator by tilting head slightly forward, grasping the bottom strap and pulling it overhead, followed by the top strap. Do not touch front of N95. Hold N95 using top strap and discard mask. Inspect and disinfect gloves. Ensure all PPE is either in red bag with coverall or garbage can with red bag. Tie bag with coverall and place into garbage can. Inspect and disinfect gloves. Sit in chair number 2 and disinfect shoes, bottoms and sides, with registered disinfectant. Inspect and disinfect gloves. using glove and glove technique. Perform hand hygiene with alcohol-based hand sanitizer. Perform final inspection of provider for any indication of contamination of clothing of the provider.
Thank you for watching our Doffing video, and keep watching our Ebola preparedness videos here on YouTube. You can call our office at 716-938-2244 for any further information. Thank you.